Are you familiar with Arava? This powerful medication is prescribed for a variety of conditions, and we're here to introduce you to its typical uses, dosage guidance, potential side effects, and user feedback. Whether you're a current user of Arava or considering it as a treatment option, this video will provide you with valuable insights. Typical uses of Arava. Arava is primarily prescribed for rheumatoid arthritis. Rheumatoid arthritis is a chronic autoimmune disease that causes joint pain and inflammation. It occurs when the immune system mistakenly attacks the body's own tissues, leading to inflammation in the joints. This inflammation can result in pain, stiffness, and reduced mobility. Arava works by suppressing the immune system, which helps to alleviate these symptoms and improve overall joint function. In addition to rheumatoid arthritis, Arava is sometimes used to treat psoriatic arthritis. Psoriatic arthritis is a form of arthritis that occurs in some individuals with psoriasis, a chronic skin condition characterized by red, itchy, and scaly patches on the skin. Like rheumatoid arthritis, psoriatic arthritis causes joint pain and inflammation, and Arava can help to reduce these symptoms. Arava may also be prescribed for other related conditions, such as ankylosing spondylitis, a type of arthritis that primarily affects the spine. It is important to note that Arava should only be used under the guidance of a healthcare professional and for the specific conditions it is approved to treat. Dosage guidance for Arava. Finding the right Arava dosage is crucial to ensure its effectiveness and minimize the risk of potential side effects. The dosage of Arava typically depends on the condition being treated, the patient's weight, and other individual factors. It is important to follow the dosage instructions provided by your healthcare professional and not exceed the recommended dose. Arava is available in tablet form, and the usual starting dose for adults with rheumatoid arthritis is 100 mg once daily for the first 3 days, followed by a maintenance dose of 20 mg once daily thereafter. For individuals with psoriatic arthritis, the recommended dosage is the same as for rheumatoid arthritis. It is important to take Arava exactly as prescribed and at the same time each day. The tablets should be swallowed whole with water and can be taken with or without food. If you miss a dose, take it as soon as you remember, but do not take a double dose to make up for a missed one. Potential side effects of Arava. Like any medication, Arava can potentially cause side effects. It is important to be aware of these potential side effects and to consult your healthcare professional if you experience any concerning symptoms. Common side effects of Arava may include diarrhea, nausea, stomach pain, headache, dizziness, and hair loss. These side effects are usually mild and may improve over time as your body adjusts to the medication. If these side effects persist or worsen, it is important to speak with your healthcare professional. Rare but serious side effects of Arava can include liver problems, lung problems, and a weakened immune system. These side effects are less common but can be severe. If you experience symptoms such as yellowing of the skin or eyes, dark urine, persistent cough, or frequent infections, seek medical attention immediately. User feedback on Arava. User feedback can provide valuable insights into the real-world experiences of individuals who have used Arava. While everyone's experience may vary, hearing from others who have walked the path you're considering can help you make an informed decision. Many users of Arava have reported positive results in managing their rheumatoid arthritis symptoms. They have noted improvements in joint pain, stiffness, and overall mobility. Some users have also found relief from psoriatic arthritis symptoms. However, it is important to note that not everyone may have a positive experience with Arava. Some users have reported experiencing side effects such as gastrointestinal issues, hair loss, and fatigue. It is essential to weigh the potential benefits against the potential risks and consult your healthcare professional for personalized advice. Tips for taking Arava. To ensure the best possible outcomes while taking Arava, here are some tips to keep in mind. Follow the prescribed dosage instructions provided by your healthcare professional. Take Arava at the same time each day to maintain a consistent level of medication in your body. Swallow the tablets whole with water, and they can be taken with or without food. If you miss a dose, take it as soon as you remember, but do not take a double dose to make up for a missed one. Attend regular checkups with your healthcare professional to monitor your progress and assess any potential side effects. By following these tips, you can help maximize the effectiveness of Arava and minimize the risk of side effects. Precautions and warnings for Arava. Before starting Arava, it is important to discuss any pre-existing medical conditions or medications you are taking with your healthcare professional. Certain conditions or medications may interact with Arava or increase the risk of side effects. Arava is not recommended for use in pregnant women or those planning to become pregnant. as it may cause harm to unborn babies. It is also not recommended for use in individuals with severe liver or kidney problems. Additionally, it is important to avoid excessive alcohol consumption while taking Arava, as this may increase the risk of liver problems. Regular monitoring of liver function is typically recommended while on Arava. Alternatives to Arava. While Arava can be an effective treatment option for rheumatoid arthritis and other related conditions, it may not be suitable for everyone. There are alternative medications available that your healthcare professional may consider based on your specific needs and medical history. Some commonly prescribed alternatives to Arava include methotrexate, sulfasalazine, and biologic agents such as tumor necrosis factor, TNF, inhibitors. These medications work in different ways to reduce inflammation and manage symptoms. Your healthcare professional will be able to determine the most appropriate treatment plan for you. Consulting a healthcare professional about Arava. If you are considering Arava as a treatment option or have any questions or concerns, it is important to consult a healthcare professional. They can provide personalized advice based on your medical history, current medications, and specific needs. A healthcare professional will be able to assess whether Arava is a suitable choice for you, monitor your progress while on the medication, and help manage any potential side effects. They can also provide guidance on lifestyle modifications, such as diet and exercise, to complement your treatment plan. Conclusion. Arava is a powerful medication prescribed for rheumatoid arthritis and other related conditions. It works by suppressing the immune system to alleviate joint pain, inflammation, and improve mobility. While Arava can be an effective treatment option, it is important to follow dosage guidance, be aware of potential side effects, and consult a healthcare professional for personalized advice. User feedback can provide valuable insights into the real-world experiences of individuals who have used Arava, but it is important to remember that everyone's experience may vary. By working closely with a healthcare professional, you can find the most appropriate treatment plan for your specific needs. Arava is just one option among many, and alternatives may be available. Consulting a healthcare professional will ensure that you receive the most suitable treatment for your condition. Remember, your health and well-being are worth investing in, so take the time to explore all available options and make informed decisions.